Back now on Triad Today, and as most of you are aware, October is Breast Cancer Awareness Month. So it's only fitting that we not only talk to someone who is a healthcare professional, but who is herself a breast cancer survivor. And she's with us right now. Debbie Moser, formerly ER nurse, but she's now Director of Staff Development and Stroke Coordinator at Northern Regional Hospital. Welcome to the show.
Thank you for having me.
Appreciate you being here. Let me get personal with you for a second. When were you diagnosed?
I was diagnosed in 2016.
2016. And what went through your mind at the moment you were diagnosed? Help me understand.
Well, a lot of things. You know, I've been a nurse for 42 years now, not quite that long at that moment. But I've always taken care of other people, and I'm a very healthy person. I ride bikes, I kayak, I hike. You know, I'm very, very active. And I just, you know, my blood pressure's low, my cholesterol's low. I'm just going along in life not thinking, you know, anything tragic's going to happen. So I was riding bikes one day, and it was in July, it was hot. And I came home and took a shower, and I raised my arm to shampoo my hair. And when I did, I felt a pulling sensation in my breast. And, you know, a nurse, I thought, well, that felt really weird.
Yeah.
So I went to see if I could replicate it. I pulled my arm back up, and sure enough, I did. So I did a self-breast exam, and I found my tumor. And so at first it was denial, you know, oh, this is scar tissue, you know, I'm always knocking around doing stuff.
Right.
But I did the next day, made an appointment to get a diagnostic mammogram and ultrasound.
Who helped you through your journey?
There were a lot of people that helped me. I found that once you kind of get in this waterfall of breast cancer care, a lot of people sort of converge on you, and they start making their plans very quickly. So once you get that diagnosis, you're automatically set up with a team. Actually, they have you to see a general surgeon who would do your whatever surgery you have, and then a plastic surgeon that will come in and do the reconstructive bit. You also have to see an oncologist and a radiology interventionalist, all that before you can really begin on your treatment.
Right.
And then a stroke navigator will contact you. So there's sort of a team that will descend.
Yeah, that's great. I'm also wondering, give me your opinion, and it's funny because, you know, I'm seeing you as a nurse and as a person, and, you know, so it's a dual question. But how important is it, and do you tell women how important it is for someone, say 40 years old, to get a baseline mammogram?
It is very important because breast cancer really doesn't appreciate an age or even a gender. You know, males get breast cancer as well. One interesting thing I found along my journey, I had to take chemo. And, you know, so for a woman to lose her hair is, you know, it's a little disturbing. So I was really curious about the timeline and how my hair was going to grow back in. So I started Googling on YouTube. You can find anything on YouTube. And I found this sweet 24-year-old on YouTube from Canada. And I really got enthralled with her story. And she had breast cancer. And she was a blogger. And now I think they call them a vlogger. And so she would go online and journal her story and have videos, and you could see her hair grow back in and all that. So now, several years later, I'm still following this young lady.
We only have a few seconds left, but I bet you've heard something that I heard. Years ago, I interviewed a lady about this topic, and she says, I'm not going to get a mammogram. I said, why? She said, because I don't want to know the diagnosis. Very quickly, before time runs out, what do you tell a woman who says that to you? Breast
cancer is highly treatable these days. It can be curable, but a lot of that depends on you getting to the doctor in time and keeping those mammograms up. And in between mammograms, do those self-breast exams, because the tumor can come up and you may not find, you don't want to wait a year till your next mammogram to find it. Exactly. And up on screen, I want people to have this website to go for general information. You can go deeper from there. ChooseNorthern.org. That's ChooseNorthern.org. Debbie, I can't tell you how important it is and what a pleasure it was to have you here and the message that you put out. Thanks for doing this. You're very welcome. Thank you for promoting breast cancer awareness. We'll be right back.